Hi, everybody. I'm Steve Sozio, one of the Scholarly Concentration's clinical research faculty, and I'm here to talk about the top tips for getting your abstract accepted. So by now, you've worked on your Scholarly Concentrations projects and are at the point where you might be starting to think about disseminating your findings. Well, an abstract is one of the most common techniques to disseminate your findings. And so I'm going to give you some tips about how to do that. So some objectives for our talk today will be understanding the purpose and selection criteria of abstracts for national meetings, and then we'll be describing the format of a well-written abstract. And then finally, we'll talk about some quick editing tips that you might be able to incorporate in your own abstract. So first, what is the purpose of an abstract? When we think about an abstract, it's there to disseminate your findings, summarize and discuss your findings, showcase your results. You put all this hard work into your project. You want to make sure that people understand how excited and passionate you are about your project. And then finally, if you're applying for other grants or other residencies, this might be a nice line on your residency application to show productivity of your work. When we think about abstracts, that's the main purposes there. And then often, these abstracts go through some sort of selection, whether it's a selection for your medical student research symposium or a selection for a national meeting. And the selection criteria vary by organizations, but typically abstracts are reviewed by about 2 to 3 expert reviewers. They might assign a summary score each of them based on the quality and the potential impact of that abstract. The interesting thing is at these societies, these national organizations, sometimes those reviewers may be reviewing up to 15 or even all the way up to 150 abstracts. So just think about that number for a second. That number is quite large in some cases. And so that's why it's important to make your abstract exciting, make your abstract show your passion, and we'll talk about some tips on how to do that. Some of the typical ways that we have selection of abstracts. That selection of abstracts, like I said, each reviewer reviews about 15 to 150 of these. And there might be 2 to 3 expert reviewers for each of those. So again, it's going to be 2 different reviewers, each of which have about 15 to 150 abstracts. Each of those 2 to 3 reviewers assign a summary score. That summary score is based on the quality and, again, the potential impact. And that selection criteria might include things like attention grabbing. Who's the audience? What are the priorities of the conference? How does it fit in with other talks? Those are some standardized criteria, but honestly, it might take some luck. The criteria may not be as formalized as one might think, and it does take some luck and some excitement from the conference. So I'm going to show you some different examples that we have for national meetings and what they've done for those reviews. So one of which is the American College of Physicians. I've served as one of the reviewers for abstracts here, and I apologize, this slide is a little bit small, but the American College of Physicians will tell you sort of what criteria they use to evaluate an abstract. And I'll demonstrate this on the next slide as well. Those criteria might include originality. They might include the emphasis, the timeliness, what's the logic of it, what's the quality of the abstract, what's the impact of this, what's the interest of this. And each of those sections are scored independently on a scale of 1 to 5. Those scores are then added together to give an overall score for that abstract. Again, 2 to 3 reviewers are reviewing each of these, and they'll give an overall score across both of those 2 to 3 reviewers. And here's the criteria again in a different format. Again, on a scale of 1 to 5, originality, significance, timeliness, the logic, the quality, the interest, and the methodologic validity. All those things with the American College of Physicians is summed across all those. And I think this is probably one of the most common types of abstract scorings that you'll see. A different type of abstract scoring is with the American Society of Nephrology, and this is just one demonstration. I've served as an abstract committee member as well as an abstract chair of this committee. And they grade their abstracts more on a holistic basis. So on a scale of 1 to 6, 6 being the highest, 1 being the lowest, 6 will be the reviewers think it's potentially newsworthy. 5 will be the reviewers think it's an oral presentation. 4 would be a top poster presentation. 3 would just be a poster presentation. 2 would be publication only, and then 1 would be not suitable for publication. Again, across the 2 to 3 reviewers, they'll average the scores and then give an overall score for the abstract chair to review. So those are some typical criteria that abstracts are graded. Now we're going to talk about the format of a well-written abstract. So abstracts typically have several different formats, but the main ones that you'll see include specific elements. Those specific elements are title, introduction, methods, results, and conclusions. When you submit to national organizations, or even when you're trying to submit a manuscript, those abstracts have specific word or character limits. Unlike a manuscript, abstracts submitted for a national meeting can include declarative statements, and I'll show what that means in several slides from now. So the first element for this is the title. So when we think about the title, again, an abstract reviewer might review 15 to 150 of these. The title is the first thing that they're going to be seeing. So the title should be attention-grabbing, and it also should tell what the study is going to be doing. So here's an example of a title. This is from the American Society of Nephrology. These have all been published in their abstract book, so I'm not showing any additional material that you wouldn't see elsewhere. So one such potential title was "The nasal carriage of methicillin-resistant Staphylococcus aureus is a predictor of all-cause mortality in hemodialysis patients." So thinking of the last slide, is this attention-grabbing? I would argue that it is. It's a predictor of all-cause mortality. Mortality is a large factor for patients, and so if we can predict what causes mortality, that's an attention-grabbing abstract. Can you tell what these authors are doing? I would argue that yes, you could. And based on this title as well as the rest of the abstract, this was actually selected for an oral presentation at the American Society of Nephrology Kidney Week. The next item that goes into a well-written abstract is the introduction. When we think of the introduction, that follows the title, and that describes the rationale for the study. It should have clear objectives and hypothesis, but it should really be concise. And I emphasize the word concise because the authors and reviewers at these conferences know the topic area. They know what's going into these abstracts. And so you really should spend your time on the rest of the abstract and not the introduction. So I'm going to show more examples than I did for titles, but here's one such example. So I'll read this out for all of you. Despite the important clinical and economic consequences of hyporesponsiveness to erythropoietin-stimulating agents, few interventions are available to improve that ESA sensitivity in dialysis patients. So again, is this concise? It's only one sentence. Can it tell what you're going to be doing or what you're interested in pursuing in this study? This does set up this study nicely, and again, reviewers for this know the subject area. They know what erythropoietin-stimulating agents are, so you don't need to go into a long background about that topic area. And based on the rest of the abstract, this again was selected for an oral presentation. Here's another example. I'm not going to read this entire one out, but I'll just go through a couple of the key points of this. So the first sentence reads, "Stercoral ulceration of the colon is rare in the nephrology literature with fewer than 100 cases reported overall. These ulcers result from pressure necrosis on the colonic mucosa by large, firm fecal masses." And then the very last sentence says, "Treatment is supportive and prevented by avoiding aggravating factors such as constipation." So this is all just in this author's introduction. So again, do we think this is concise? I think this is clearly not concise. This appears to be just a review of the literature in their introduction rather than telling what the authors are going to be pursuing in their research. And based on the rest of this abstract as well, this was selected for publication only. So those are just two examples of introductions. Some examples of now we're going to go through the methods. The methods are the meat of your abstract. They tell what you did as well as the population, the variables that you're looking at, the analytic methods. And just like the other two sections, this should also be concise, but when I say it's the meat, people need to know what you're doing in the study. So it should be detailed enough to know what was done. And so here's a couple examples that we'll go through. The first example here says that 1,795 subjects were screened for the modification of diet in renal disease study, which examined the effects of dietary protein restriction and strict blood pressure control and progression of kidney disease in 840 randomized participants. This analysis included 942 non-randomized and 839 randomized participants with serum bicarbonate measurements. They measured survival status obtained from the National Death Index. Cox models were used to evaluate the relationships of these things with all-cause mortality. So again, this doesn't look quite as concise as the title and introduction we reviewed earlier, but can you tell what the design of this study is? Yes. Can you tell what the authors did methodologically? Yes. Can you tell what their population and number of participants was? Yes. Does this seem exciting as far as the methodology and as far as the potential results? Yes. And based on those results that followed, this was also selected for an oral presentation. Another example, we studied 59 patients with lupus nephritis and end-stage renal disease. 28 were being treated with hemodialysis. 14 were undergoing peritoneal dialysis. 17 underwent kidney transplantation. We analyzed clinical course, including patient survival. You cannot tell what these authors did with their analysis. You cannot tell sort of the methodology there. And this is a smaller study as well. And so this ultimately was selected for publication only. And so now we went through the methods, the introduction and the title. We're going to go through a couple of different items. And so the first item that we'll talk about is the results. The results are really where you shine with your findings. You really want to demonstrate what you found, what's the next steps with these. And so this is really the key point of all your hard work in your scholarly concentrations work. And so when we talk about the important parts of results in an abstract, we talk about several different things. We talk about giving specific data. In general, you want to avoid results will be presented. Your abstract should stand on its own. The reviewers should be able to tell what you did, as well as tell where you're going with these findings. It should be interesting, so you don't want to present too many results, but it also should be consistent with what you presented in your introduction and also what you presented in your methods. When possible, try to have comparative statistics. So descriptive studies are important, but often reviewers also want to look at comparative statistics. So does one group compare relative to another? Is there an outcome involved? And in particular for abstracts at national meetings, you can actually use figures and tables. Figures and tables can tell those things in a much clearer and shorter image, and they say a lot more, take up less space than text. And again, if a reviewer's looking at 15 to 150 of these, that actually might be a better picture and an easier way to grab their attention. For certain national conferences as well as for manuscripts, unfortunately you do need to use text to present your findings. So again, using the American Society of Nephrology published literature, I'll go through a couple of results with this. So here's one such study. This study stated that mean age was 52, glomerular filtration rate was 39, and serum bicarbonate was 23. Subjects in quartile 1 were younger, non-white, lower GFR and serum albumin, and higher protein. So already at those first two sentences, they're setting up what their population was. They're setting up who was involved in the study, what the demographics of the those characteristics were. Then the next sentence, crude mortality rates over a 10-year follow-up period were 31%, 25%, 21%, and 25% in bicarbonate quartiles 1, 2, 3, 4, respectively. So again, starting broadly, the demographics, starting with the initial results, their next sentence says, in an unadjusted analysis and after adjustment, quartile 1 of serum bicarbonate was associated with higher risk of mortality compared to quartile 4. Then they refer you here to a table. If we look at that table, if the reviewer was just looking at that table, you can see the main results of this study. You can see what the interesting things were in unadjusted models, as well as Model 1 and Model 2. They talk later in that figure about what Model 1 and Model 2 are, and you can also see across those quartiles. So even without the rest of the results, you can see the main findings here just looking at that table. The next sentence says, adjustment for GFR and proteinuria rendered the association non-significant. We observed similar findings in analyses with serum bicarbonate as a continuous variable and dichotomized at 20 milliequivalents per liter. So I would argue that these results give a complete picture about the study population, who that study population is, what mortality rates there are, what adjustments they did, what their findings were, and made those findings interesting, not only in the text, but also in that table. And that was selected for an oral presentation. The next study here I'm going to show, I'll read through this as well. Although low systolic blood pressure, or SBP, was associated with increased mortality in all patients, the relationship was more pronounced among older patients and those with diabetes. Higher systolic blood pressure was associated with increased mortality primarily among young patients, regardless of race or diabetes status, and overall mortality was lower among black versus white patients at all levels of SBP. However, in subgroup analysis, the difference was observed only among older patients, and among patients with high SBP, mortality was similar among diabetic and non-diabetic patients. So that's a lot to get through in the results section. I would argue that those those are the key findings that these authors had, but they might be difficult to follow just in and of themselves. But what the authors included here is a figure of those same results. And again, a picture is worth 1,000 words, and you can see with these figures, you can start to see some of those relationships that these authors discuss. And this ultimately was selected as an oral presentation as well. The next demonstration of results is this one. So we present a case of fungemia caused by Cryptococcus laurentii in a young man with membranoproliferative glomerulonephritis on aggressive immunosuppressive therapy. Just a brief pause. It's okay if you don't remember what membranoproliferative glomerulonephritis or Cryptococcus laurentii is. You can go ahead and look those things up later. But that's what these authors are studying. In this case, we also considered a tick-borne infection because of an endemic area of ticks occurrence. And most cases of fungemia caused by Cryptococcus laurentii were successfully treated with fluconazole. In our patients, after 2 weeks of fluconazole treatment, we still observed septic fever and positive microbial blood tests. Therefore, among the others, the computer tomography of abdomen was done. We observed an inflammatory focus near the right lobe of the liver. Accordingly, we started treatment with itraconazole. Controlled microbiologic tests after 5 weeks of itraconazole therapy were negative. So the authors describe what they found in this study. This was a case report, but this study is not a comparative study, and I argue that comparative studies are much more powerful in general than descriptive studies. There is definite benefit of reporting these results, but ultimately at the suggestion of the conference or as a result of luck, this was selected just for publication only. Okay, so we talked about the title, we talked about the introduction, we talked about the methods, and then we talked about the results. You can see how these things are lining up one after the other to really tell a story about your study and tell about where your study is going. The final part is putting it all together, the conclusions. So the conclusions are the summary of what your main findings are. So they're not just a repeat of the results, they're really summarizing what authors or what reviewers should really pick from these findings. The other part about a conclusion portion is that it really talks about the implications of your results as well. Typically, for an abstract at a national meeting, this is 1 to 2 sentences. Again, the meat of your abstract is going to be the methods, and it's going to be the results. So the conclusion is just really telling the next steps. Your methods and your results should really carry forward your study. And so when you do this portion of the abstract, state what your study added, what the next step is. And again, I'll show a couple examples of this. So here's one such example. Pre-dialysis SPP values that meet the current KDOQI guidelines were associated with increased mortality in incident hypertensive patients, irrespective of the number of antihypertensive therapy medications prescribed. Future randomized controlled trials should assess BP goals and antihypertensive therapy medications, that's the AHT. So this study did not repeat the results, but the conclusion showed what the key findings there. So the values of systolic blood pressure that met guidelines were associated with increased mortality. That's an important finding. That's saying, wow, this is an important finding for us to look at, us to think about not only for our own patients, but for the next studies as well. And then the authors propose what those next studies might be. So future randomized trials should assess these goals. So they give not only the important findings of the addition that this adds to the literature, but also what the next steps might be. And this was ultimately selected for an oral presentation. The next example I'll show, I won't read all of this. These findings contrast sharply with 2 previous cited studies despite our high-risk cohort. Several factors, especially patient selection bias, primary versus secondary versus tertiary practices, clearly play important roles in determining CKD outcomes. The current notion of relentlessly progressive loss of GFR and a smooth continuous course over time in all CKD patients is not based on reality. To the contrary, et cetera, et cetera, et cetera. You can read at your own leisure. And what they conclude with large prospective community level studies are warranted to help improve our understanding of the natural history of CKD progression in the general population. I even have a hard time saying this entire abstract. And you can imagine if a reviewer is looking at this, this takes up the large portion of the word count for this abstract submission. And so the meat of this, the meat is not likely in the methods and the results, the meat is really here in the conclusion. And so based on some of these factors, based on this not really setting up the next step or showing the main findings, This was just selected for publication only. Okay, so hopefully we've given you some examples here about the purpose and selection criteria of abstracts for national meetings, as well as the format of a well-written abstract. The final portion we're going to have for one slide is just some editing tips for your own abstracts. So I mentioned earlier that many of these abstract submissions have character and word limits. Those character and word limits are hard rules. You can't go, if it suggests 250 words, you can't have 251 words. 250 words is a hard stop. And so as a result of that, you need to be creative with how to get that number down. So you may need to take out middle initials or some affiliations for your authors. So for instance, my full name is Stephen M. Sozio, MD, MHS, and then if I'm submitting for the American Society of Nephrology, I would include my affiliation with them as FASN. So I can actually shorten that just to S. Sozio, and you can see how many characters and how many words that decreases as a result. Likewise, my entire affiliation is Johns Hopkins University School of Medicine, both Department of Medicine and Epidemiology. So that might be shortened to either Johns Hopkins Medical Institutions or Johns Hopkins University. That's likely fine. People can still see where I'm from, and those things actually can be included in the word count for the abstract. The next thing might be the introduction. Like I said, reviewers and people at the conference will know the background. They'll know what the literature shows, so you can decrease a large portion of your introduction. The next portion is actually the creative portion. So some of the things that we typically think of as words, we can actually cut back to decrease how many actual words there are. So for instance, December 31st, 2015, that would include 3 words. If you abbreviate that to 12/31/15, that now becomes 1 word. Likewise, tables and figures I mentioned earlier can take up actually less characters than just using text. And then finally, for some abstract submission sites, they can use symbols. So instead of using the ampersand, the star symbol, you can actually use, on the keyboard, you can actually use that as a symbol. And that symbol might actually not take up character counts. So no matter what program you're using, it's important to figure out not only what the criteria are, word and character count, but what the individual intricacies of that program are. And so these are some typical editing steps that we take. There might be other ones as well, but I think the key parts about this to decrease the amount of characters is to cut back the introduction. That's, out of all the abstracts that I've seen and edited, that is the key place where a large number of students, a large number of fellows, large number of faculty actually have too much introduction. So to sum all that up, the abstract is your chance to shine. It's your chance to highlight all your hard work that you've put into scholarly concentrations. I encourage you to stay clear and concise in your abstract, but also let the reviewers know what you have found. When you're doing these abstracts, you want to avoid extending your conclusions. So only state what you've actually found, but don't be afraid to actually make direct potential implications. So this suggests that we might want to do another study. This suggests that our care of patients may change. Again, with a large number of reviewers looking at these, you want to use high impact, easy to read title. You want to use text and figures and tables that are attention grabbing, people can follow as well. And then finally, much of the final selection criteria is dependent on the priority to the conference. So even if you're selected for a publication only, or even if your abstract's not accepted, do not become discouraged. Be passionate about your work, carry forward to the next work, and be excited about scholarly concentrations and all that has done for you. So hopefully this has given you a flavor about an abstracts and how the format of an abstract is. I encourage you to continue working with this, work with your mentors on the abstract, keep editing it, because this, just like the work that you've had in scholarly concentrations, this is not only a skill, but this is an art that you will continue to master over the course of your medical career. Thank you for your time and enjoy your day.